All right, to health news now. Today is World Cancer Day. The purpose really is to unite the global population in the fight against all cancers. Joining me this morning, Executive Vice President for the American Cancer Society, Jeff Falis. Good morning. Good to see you.
Good morning. It's great to see you again.
So, Jeff, we've talked through this pandemic several times early on when those, elective surgeries and even screenings were appropriately put on hold. But by this point, the message from doctors has really been get your mammograms, get your colonoscopies. Those screenings can be life-saving.
Absolutely. When cancer is caught early, it's typically easier to treat. And when the pandemic first hit, as we discussed earlier, a short delay in screening or seeing your doctor was appropriate. But today we know so much more about COVID-19. Healthcare and screening facilities have taken all the measures to protect those patients. But unfortunately, we're still not seeing folks get in and get screened. We're not seeing folks present themselves with symptoms. And that means far too many cancers are being left to grow unchecked.
I want to show folks some stats. In the U.S., studies found more than 1/3 of adults recommended cancer screenings during this pandemic. 43% of patients missed routine preventive appointments due to COVID-19 fears, and an estimated 22 million cancer screenings were canceled or missed. That was between March and June 2020. So, of course, some of this is due to fear of COVID-19, but some of it is also based, Jeff, on access to health care, access to health insurance.
Absolutely. The pandemic has really given cancer the advantage, and the balance of risk has shifted significantly. And patients are continuing to wait on those preventative screenings, and there's been 12 million people in the U.S. that have lost jobs and their subsequent health insurance. And, we're working hard to try to prevent a tragedy on top of a tragedy, and we're doing everything we can to stop cancer from getting that advantage. We're launching a nationwide initiative to encourage people to return to screenings. We're working through our advocacy efforts to really improve access to care through our legislative efforts. And we're helping people navigate the health insurance and Medicaid processes 24/7, 365 days a year through our National Cancer Information Center.
Jeff, a common question that I'm getting a lot: should cancer survivors get the COVID-19 vaccine? What's the American Cancer Society's stance or recommendation with this?
Well, absolutely. First and foremost, talk to your doctor. Okay, because, obviously, depending on the type of cancer you have, where you sit in that treatment sequence, they can advise you, but we're trying to encourage anyone that is, with their doctor's approval to get the vaccine. And absolutely, if you're a caregiver out there, get the vaccine as well. Most historical vaccines carried some type of live virus. The COVID-19 does not. So there's no risk of passing it on. And if you're a caregiver for a cancer patient, it's imperative that you get the vaccine as well.
I'm glad you mentioned caregivers. Support for cancer patients and caretakers right now, all so critical because it can feel so isolating to go through a diagnosis or a treatment during a pandemic, especially. And you talked a little bit about resources, but what do you have that you can share with us for people who find themselves in this boat?
Well, a cancer diagnosis is hard enough, but during a pandemic, it really does isolate people. And we're there for anyone who needs to reach out, even without a pandemic. We're here for patients. We're here for families. We're available anytime, day or night, through our National Cancer Information Center. You can call us at any time, and we're happy to answer questions, provide support, or even just a friendly voice in your cancer fight. And just know you're not alone.
And Jeff, finally, for survivors who are looking to regain strength, I have a lot of them in my Fitter Together Facebook group. They've been asking me about nutrition or fitness guidance. How do they kind of get back into the game? Do you guys have anything for those folks?
Oh, we have a wealth of information because, listen, eating healthy, physical activity are the cornerstone to cancer prevention. We've been saying that for years. And if you go to cancer.org, you can find all kinds of information. You can find recipes. You can find, any information you need. But then also, let's get more people to join your fitness group and others. There's plenty of ways to stay active, even when you're isolated. And we just encourage people to eat right and stay active.
Okay, Jeff, Good to see you. Thank you so much for your time as always.
Good to see you, Sonia.